There are certain people who you would have heard that they go underground and sit for days and months without food and water and nothing happens to them. People call them yogis, some call them monks, but they're essentially humans like you and me. So do you believe in any of these stories? Do you? Or are you skeptical about these things? Here comes, this is the documented evidence. It's a cutting from the London newspaper. It was taken in 1936 when the person you can see over here is Sri S. Pallupar. He is a South Indian yogi and he was actually filmed by one of the the reporter, Mr. P.T. Plunkett of London News, and he saw him rise in the air and he remained in air for like 4 minutes. And this was documented. It's a real thing. And he actually confirmed the absence of anything underneath the person. So, are you still doubtful about these feats being achieved by people? There are certain stories wherein people, there are monks who live in the Himalayas and they evaporate the water if they are sent with a cold. In those climates, if they are put a cold sheet on them, they evaporate the water using the body heat in sub-zero climate. So even those things are possible by humans. So how is it possible? So let's study a little about the history of meditation, followed by what is meditation, then what are the benefits of meditation, effects of meditation on physiology, the mechanics behind the effects, then certain meditation techniques. Coming to the history of meditation, the oldest documented evidence of the practice of meditation is the wall art in India, which is found, it is dated back in 5000 BC. And in 15,000 BCs, we find the oldest written mention of meditation in the Vedas, which is the religious text of the Hindus. So that is the oldest text which we found in 1500 BC. Then in 6th century BC, we all know that Siddhartha Gautama, he sets out to reach enlightenment, learning meditation in the process. And finally, using meditation techniques, he becomes Buddha. Then in 10th to 15th century AD, in Christianity and Islam also certain forms of meditations develop. Coming to the modern world, in 1936 it was the first time when an early piece of scientific research on meditation was published. In 1950s through 1980s, it was a large increment in the research and meditation processes seen all over the world, particularly in the Western world. East was known for having such practices, but West was untouched by these things. So during 1950s to 1980s, there was a large increase seen in these researches and benefits of yoga seen in Western world. And in 2000, there was the first major clinical trial of mindfulness with cancer patients. And it was seen that the cancer patients were benefited by meditative techniques. So, after knowing so much about it, what exactly is meditation? Meditation has been described variously by various people, starting from the East, where people used to consider it as a tool for self-awareness. It was a way of enlightenment for attaining higher consciousness. However, when it went to the West, it became to be known as an exercise for mind, to keep it clean and healthy. It was taken to be as a relaxation technique to relieve one of stress and stress-related illnesses. However, meditation is more than relaxation, and it has got a deeper significance in yogic parameters if we see. As is rightly said by Sri Aurobindo, that in moments when the inner lamps are lit and the life's cherished guests are left out, our spirits sit alone and speak to its skulls. And the life's cherished guests are what? The ego and the desires that one has in the life. So when those things are kept out of way, one reaches beyond the physical parameters and goes to understand what the real self is, what is the higher dimension of the self. So we are using word yoga and meditation quite interchangeably, but there is a difference between yoga and meditation. So what exactly is the difference? Yoga, as has been now treated as just mere certain postures and attainment of certain asanas, while it is not that, it has a bigger and deeper understanding. It is a way of life which is based on certain view of life. So the yogis are the people who don't view the life just as in the physical dimension. They look beyond physical dimension and try to attain a self which is higher than the physical manifestation of the body. So they talk about higher spirits, higher consciousness. They talk about attaining reality, the true reality, attaining the ultimate. Some call them God, some call it the nature, higher consciousness. Multiple names have been given. So that is what yoga is. It means union, the union between the self and the higher consciousness. While meditation is one of the components of yoga, it is a part of the yoga, not one of the very essential techniques used to attain that higher self. Now wait a minute. I would want to ask you all, are you like people confused, or why are we really studying this over here? We are the students of modern medicine, and why are we being taught about higher consciousness, yoga and attainment of self and these things? Is anybody there who's thinking, yeah, kahan phas gaye, hum log kyun yahan baithe hue hain? So let me tell you, it is very, very relevant in today's time to know. First of all, why in physiology? So we all know that physiology is primarily what? It is the study, so it's the study of the functions of normal human body, right? But we also study physiology in various conditions like exercise, various temperature changes, high altitude, low altitude, deep sea. We all consider these things. Even when a person goes into these different environments, the body alters its function, but still the human will be considered as normal. So yoga also takes you into altered state of body functions, but still the person is human. Rather, one can say superhuman, because the functions have improved quite a lot. So meditation, which alters bodily functions, it comes under the realm of physiology, and thus we need to study it. Then, since it is so much popular now, it is most of the illnesses now we see are health related, are lifestyle related illnesses. They are psychosomatic illnesses. So a lot of problems are because of lifestyle, and yoga and meditation is one of the the greatest of all the lifestyle techniques found by mankind that can be said. So there will be people who will come to you asking about, will meditation help us? Should we be doing yoga? Will they be helping us? So it is ultimate prescription for health, peace and joy. So when they ask you certain questions, you need to answer them well, that meditation helps or not, and how to do it well. And the other thing is, it will be benefiting you. So the positive attitude and peaceful mind are conducive to healing and happiness. So a happy doctor will be able to heal the patients better. So it will be for you, because medicine is not it's a very stressful life. So for your benefit, to keep your mind in peace and happiness, if you find it really relevant, you'll adopt it in your life, and probably your patients will benefit because they'll be coming and meeting a very happy and cheerful doctor. So that helps in healing too. So these are the reasons why you should be learning about meditation. All right. So let's see, since we have talked so much about it, what are the real benefits of meditation? So meditation can actually help you heal plethora of diseases like arthritis, allergy, asthma, from irritable bowel syndrome to tension headaches to constipations, menopausal pain, depression, anxiety, skin disorders, chronic fatigue syndrome, overweight, sleep problems, anything. They can benefit in all. अभी ऐसा लग रहा होगा क्या कुछ भी बोल रहे हैं, मेडिटेशन से इतनी सारी चीजें, तो फिर दवाइयां क्यों होनी चाहिए, सब बंद कर देना चाहिए, सबको मेडिटेशन कराने लगा दो. So these are not just things which are said, there are research based evidence which tell us that these things work. So within 7 weeks of meditation, even cancer patients were found to benefit with the meditation. The stomach symptoms were reduced by 50%. They felt more vigor. And within 10 weeks of meditation, 2/3 of chronic pain patients had 30% reduction in the pain. With 10 weeks of meditation, they had less mood disturbances. Then 3 years, they were benefited from anxiety and panic disorders. The fibromyalgia pain went over. And the quality of the sleep in those patients improved. Not just there were psychosomatic disorders including asthma, rheumatism, blood pressure, diabetes. All of these diseases were found to have benefited by doing meditation. Then there were inflammatory reactions which were found having benefit. Now with 6 months of meditation, athletes had less increase in the CD8 plus suppressor T cell response to strenuous physical exercise, improving the immune system of the helper. It also reduced post-traumatic, the stress. It helped patients with psoriasis to heal quicker the skin diseases which are known to be chronic and last for years and years. Furthermore, there was found that within 4 years of daily meditation, the coronary artery narrowing was shown regression rather than progression. And it was a visible change in those arteries seen, and it was documented. There was 50% less hospital admissions, including a reduction in 17 major treatment categories such as benign and malignant tumors, heart diseases, infectious disease, and nervous artery wall thickness was found to be reduced. So these are some of the benefits of meditation. Now, what are the effects of meditation on physiology? I've motivated you enough now, telling you the benefits and why you should be studying. So now let's come to the main topic, like what are the effects of the meditation on physiology? So we all know that meditation reduces heart rate, respiratory rate, oxygen consumption. It reduces blood pressure, muscle tension, blood lactate levels. So it has got effect on all over the body, multidimensional effects. It also increases percentage time spent in alpha rhythm in EEG, which we will be studying in detail later. It is found to decrease oxygen consumption, and that is the reason why Wallace, Benson, and Wilson, these are the scientists who described meditation as wakeful hypometabolic state. It is a wakeful hypometabolic state. And other than meditation, there are only 2 such states known. One is that of sleep and the other is hibernation. However, metabolism, it is found that meditation differs from sleep in that the fall in the metabolic rate is much greater and more steeper by meditation than in sleep. So if you are meditating, it is relaxing and helping you much more than what sleep helps you do. So metabolism is a good indicator of the rate at which we live, as we all know. So if meditation slows down metabolism, does it slow down also the wear and tear of the body which is brought about during as we live and we grow? So in other words, what I'm asking is, can meditation slow down aging? What do you all think? Can it? I can't hear. Say loud. Can meditation slow down aging? It can? Yes, it does. So it has been found that meditators with more than 5 years of experience in meditation were found to be 12 years younger biologically than their counterparts. So their chronological age may be 50, but their biological age was 38. It was much lesser than that of their counterparts. So it helps. Now we'll see how it really helps that. So coming to the effects of meditation on ANS, it has been found that increases meditation increases the skin resistance. So galvanic skin response showed that meditators recovered from stress more quickly than non-meditators. There was decreased limbic arousal in the brain, reduced stress, and increased autonomic stability to stress. Now that might explain how meditation strengthens and enhances one's ability to cope with the stress. Coming to the effect of meditation on CNS, it decreases muscle reflex time, it accelerates neural conduction or augments the release of neurotransmitter, thereby decreasing the synaptic time, resulting in a change in the muscle firing threshold and its pattern. Also, by inhibiting the left cortical hemisphere, the sense of time and logic no longer dominates the consciousness while a person is meditating. So when a person is meditating, the person loses the sense of time, logic, space, everything, although the mind is not asleep. So these are the effects that we see. Coming to the effect on endocrine system, we have seen that it reduces lactate, cortisol, and epinephrine. It also reduces sympathetic adrenergic receptor sensitivity, producing a decreased response to stressful situations. Also, there will be increased levels of GABA, melatonin, and also meditation produces its anxiolytic effects by promoting GABA action in specific areas of the brain. And you know that GABA is important for, what is it? It is inhibitory neurotransmitter. So it has an anxiolytic effect. Coming to the meditation and metabolism, as we have already seen that it decreases. It is a wakeful state, but it is accompanied by decreased metabolism. So decreased breathing pattern, decreased heart rate, decreased blood pressure, decreased oxygen utilization. So these are the things which bring about decrease in the metabolism. So metabolic changes which arising in meditation are a natural reduction in the metabolic activity which occur at the cellular level and not from the forced reduction of the breathing. So this is important to know. And this is the way how we achieve longevity and delayed aging. So we have always known and seen that the yogis and the monks live like they cross centuries, and maybe they live longer than the usual life expectancy of normal human beings. So this is the reason why they can achieve such feats. Coming to the effect of meditation on neuroplasticity. A recent MRI study showed that the brain regions associated with attention, interoception and sensory processing, like the prefrontal cortex and the right anterior insula, they were thicker in meditation practitioners. So meditation probably offsets the age-related cortical thinning and thereby suggesting to promote neuroplasticity. So as we all know that our brain ages, so with aging, the cortical thickness reduces. So what is meditation really doing? It is preventing that thinning from happening. And this is how it promotes neural plasticity. Coming to the effects of meditation on psychology. So practice of meditation improves cognitive task performance, mental concentration. It reduces susceptibility to stress. And you all are under a lot of stress because there are 3 big subjects that you have to cover in first year. So you always consider कि यह कैसे खत्म होगा, पोर्शन कैसे खत्म होगा, अभी आया नहीं कि एग्जाम आ गई. So primarily टाइम तो लिमिटेड है, उसका कुछ नहीं किया जा सकता, but you have to improve your efficiency. And meditation is one of the very effective ways to improve your efficiency, to improve concentration, and in lesser time you will be able to achieve and learn more. It also improves it enhances perceptual sensitivity. It improves the attitude and personality of a person, improves mood, sleep, and scores on self-actualization. Also, there is improved concentration, attention, greater productivity, problem-solving skills, creativity, learning ability, organization of memory. All of these things increase when you are meditating. So are you now thinking about yes, right, शुरू तो करना चाहिए. इतना अगर फायदा कर रहा है तो start तो करना चाहिए. Apart from just that, it enhances self-image. in your teenage, ये कैसा सोच रहा होगा मेरे बारे में, वो क्या सोच रहा होगा, कैसे हम दिख रहे हैं, क्या दिख रहे हैं. Lot of people go into depression because of negative self-image. Meditation helps you to improve those things. Not just that, it helps you to be better sociable. It helps you to become more tolerant and compassion. Your parents must be comparing, आजकल की generation बिल्कुल सहन शक्ति नहीं है, कहीं से tolerant नहीं है. तो उनके लिए नहीं, लेकिन अपने लिए टॉलरेंस बनाना जरूरी है और कंपैशनेट बनना जरूरी है. तो these are some of the effects of meditation on the physiology and psychology. So, what are the mechanisms behind the effect? How does it really work? सुन तो लिया, बट हम साइंस के स्टूडेंट्स हैं. जब तक पता नहीं करेंगे कि होता कैसे है, मानेंगे कैसे? पता तो हो गया कैसे करना होता है, पर कैसे होता है? तो the mechanisms which produce meditative effects, they include metabolic, autonomic, endocrine, neurological and psychological manifestations that we have already seen. So the physiological response to meditation, it occurs in multidimensional way and an integrative basis. It has got, and it integrates all the system and affects all the system of the body. So it is multidimensional and also integrative in its approach. So now let's see technically and scientifically, based on the researches, what are the effects and mechanisms behind the production of these things. So neuroelectrical changes seen in the EEG while a person meditates. Firstly, a little about what are these waves. So when we put electrodes on the scalp of a person to record the electrical activity of the brain, we see these types of the waves, electrical waves that we can record. First is the beta wave, which is around 14 to 20 waves per second, and we'll see those in detail. We'll first see the names. So there are beta waves, 14 to 20 waves per second, alpha waves, which are 8 to 13 per second, theta waves, 4 to 7 waves per second, and delta waves, 3 to 4 waves per second. And then there is high delta waves, deeper and dream nick. There are another delta waves which are less frequent, 0.5 to 2 waves per second. So in the count, here you can see the diagram. So these are the waves, and these are the ways how you identify those waves while the EEG is being recorded. So you count the number of waves so that you know, okay, this is the frequency, so this is the wave, right? Okay. So alpha waves, they are brain waves of relaxed, detached awareness. Okay, so when you close your mind, just beginning to sleep, when you visualize, so that is the time where the alpha waves begin. Okay, so it is considered to be the gateway to meditation and provides a bridge between the conscious and the subconscious mind. That is what the alpha waves are considered to be. Coming to the beta brain waves, they are the fastest frequency, ranging from 14 to 38 cycles, as we have already seen. So they are present when in your normal thinking state. Like right now, if you're thinking normally, so you must be having, if your EEG is recorded, you'll be seeing beta waves coming. So your active external awareness and thought processes are detected or denoted by beta waves. So without them, you won't be able to function in the external world or the world around you. Now coming to the theta waves, they are subconscious mind. They are the waves of the subconscious mind, and they are slower waves, 4 to 8 cycles per second. Theta is present in dreaming sleep and provides the experience of deep meditation when you meditate. Theta also contains a store of creativity, inspiration, and when you often have your spiritual connections. So this is what you see in the waves of meditators as well. So in meditation, the brainwave pattern is a combination of alpha as well as theta waves, wherein the theta provides the depth and profundity of the meditation experience. That is the subconscious inner space from which the creativity, insights, and healing spring. While the alpha provides the bridge or the link between the conscious thinking mind and the subconscious experiences that are happening, so that you can actually remember the contents of your meditation. So this is the pattern that you see in a meditator. So what about the delta waves? They are the waves of your unconscious mind, which are recorded in the sleep state. and range around like 0.5 to 4 cycles per second. But when they are present in combination with other waves, like alpha and theta waves, they form like a radar seeking out information. So reaching out to understand on the deepest unconscious level, the things that we don't understand through thought processes. So delta provides intuition, empathetic attunement, and instinctual insights. So there are certain people or the yogis that you go, they may tell you about, okay, this might happen, that might happen. They have a certain intuition. So how do they develop those things? Because of the meditative processes. So even though they are human, the feats that they achieve or the things that they can do, we find them superhuman. But is it like something that you and I cannot achieve? Is it something that they have gotten from the birth and we cannot do that? No, they have practiced to achieve it, and so can we. So what are the major EEG findings during meditation? They are increased alpha, increased theta production, and increased high beta waves. So what does alpha pattern? Alpha patterns are associated with calm and focused attention. Theta patterns are associated with imagery and creativity, and high beta activity is associated with highly focused concentration. Also, there is increased synchronization seen between the brain waves when you record EEG. And there is dissociation of perception from external sense organs. So it has been found that while a person or a yogi or a meditator is meditating, while he is meditating, if you produce any sensory stimulus, sudden sensory stimulus, you don't record any disturbance in the EEG wave pattern of the one who's meditating. While when you compare it with somebody else, like you and me sitting in a normal state, if any of those sudden sensory stimulation is given, you would see a change in the EEG pattern. So how do they achieve it? Because there is dissociation of perception from the external sensory environment. But then they are awake. It's not that they are unconscious. They are very well awake, but then they can control their sensory perceptions. There are certain permanent EEG changes also seen. So using functional magnetic resonance imaging, that is fMRI, on the meditating monks, Davidson, it's the name of a scientist, he found that their brain activity as measured by the EEG was especially high in the left prefrontal cortex, and this is the region of the brain which is associated with happiness and positive thoughts and emotions. So with chronic meditation, also the gamma wave activity is found in many meditators. So the presence of gamma wave activity in a meditator indicates that there is higher level of information processing happening in the brain. So their brains are much more active while the metabolism is low. So their body, which we can consider as a machine, is much more effectively working than what yours and mine works. We use a lot of energy, but our productivity is less. They use less amount of energy, but they produce more. They can work more. So that is how you can make your body, which some people can consider as a machine, as a very effective machine to work. So there are certain PET scan findings. PET is positron emission tomography. So in those scans, when it was compared to quiet or slow wave sleep, in which the brain blood flow is reduced, meditation shows no reduction in the total brain circulation or perfusion. So the blood perfusion to the whole of the brain is normal while a person is meditating. While in sleep, the blood flow reduces. Okay? But however, so the total brain blood circulation is not reduced, but the regional maps of this brain shows differentiation in the blood flow. So while a person is meditating, there are certain parts of the brain which are receiving more blood than the others. And that is the reason why probably there is the hypothesis that because of this, the effects of the meditation are produced. Another SPECT findings, this is a single photon emission CT scan. they find that the parietal area of the brain, which is responsible for giving us a sense of our orientation in space and time. So in meditation, these sensations and cognitive input to these areas are blocked, and thus that results in the sense of no space and time that the meditators feel. It is because there is low and reduced blood supply to the parietal areas. So here in these pictures you can see these are SPECT images, wherein you can see that this is the baseline, wherein this is the blood flow to the prefrontal cortex area, while during meditation you can see that the blood flow has increased. In another picture you can see here that the blood flow to the parietal lobe area, the superior parietal lobe area, has been reduced in meditators while compared to the baseline state. So the major findings found in the SPECT were that there is increased regional cerebral blood flow in frontal lobe area, while there is a shutdown of regional blood flow in the parietal and occipital areas. Okay, while the total blood flow, you should remember, to the brain does not decrease. So there is a redistribution of blood in the particular brain areas while a person is meditating. Also, fMRI findings show significant signal. fMRI's functional MRI recordings. So they show significant signal increases were observed in the dorsolateral prefrontal and parietal cortices, thalamus, hippocampus, parahippocampus, temporal lobe, pregenual anterior cingulate cortex, and other areas. So that indicates that the practice of meditation activates neural structures involved in attention and control of the autonomic nervous system. Okay, so these are the images wherein you can see certain areas being shown in the fMRI scan. So what are the neurochemical changes during meditation? So primarily, we have seen the neurological changes. Now we are coming to the neurochemical changes, the electrical changes, now the neurochemical changes. So meditation increases serotonin production. It also stimulates the increase in the production of acetylcholine. Now what does these things do? Serotonin is known to influence mood and behavior in many ways, while acetylcholine is known to involved in memory mechanisms and attention. So both of these things are increased in meditation. It also has been associated with increased melatonin availability. During meditation, locus coeruleus activity decreases, thereby it decreasing the amount of norepinephrine production. So relatively greater activity of parasympathetic system causes the decreased production of catecholamines, epinephrine, norepinephrine by adrenal medulla as well. So parasympathetic activation is more and sympathetic activation has been reduced. Also certain other neurochemicals like serotonin, acetylcholine, their amount has been increased to produce, that is the reason why the desirable effects of relaxation, good mood, positivity are seen in the meditators. This is a chart showing where are they released and what are the changes which are observed. Coming to the mechanisms behind the psychological benefits. So the factors which decrease anxiety during meditation are, there is increased parasympathetic activity, increased GABAergic drive, serotonin, endorphins, all of these are increased, and that leads to decrease in the anxiety. Also there is decreased locus coeruleus firing with decreased noradrenaline. So again, the stress hormone cortisol is reduced. And then what are the factors which decrease depression during meditation? So there is again increase in serotonin, dopamine, melatonin, endorphin, and decrease in cortisol, which leads to decrease in the depression. But here there is a caution. Now we have seen what meditation can do and how well it can benefit. But does it benefit everybody? It is psychosis is a variety of schizophrenic effects. So those can be seen in certain patients who are susceptible to developing psychosis, and the mechanism behind that has also been stated as increase in the 5-HT2 receptor activation leading to inhibition of lateral geniculate body, or increase in dopamine which affects the temporal lobe. So these are the reasons why certain people, so what are the contraindications? So in people who are suffering from psychosis or confusional states or dementia or certain conditions, they are not encouraged to get into meditation or practice meditation, because that might lead to development of further enhancement of the symptoms rather than decrease in the system. While anxiety and depression are benefited, meditation helps in reduction of those states. Okay. Now there are certain unresolved issues. These were the researches which had been done already, and we have the effects of those researches. But then there are certain things which are unknown in the realm of meditation and the effect of how meditation produces those effects in the body. So although we can understand how the various lobes and neurotransmitters function during meditation, how are these actions directed and by whom, we do not know. What accounts for the actual awareness of the experience and of the self, and where are they perceived, we don't know. How do we actually know that something is true and meaningful? What accounts for this conviction, we don't know. The link between the master within and with the cosmic consciousness has not been explained. So there are certain deeper questions in life. Where do we come from? What is the meaning of life? What is the higher self? What are the consciousness? Where is the seat of consciousness? What actually gives subjective experiences to us? This is something that the science has not been able to tell till now. But the processes are on. We are still into the process of researching, and hopefully we'll come to know the answers of these questions. Now, since it has been so much has been told to you, are you now curious to know how exactly is meditation really done? Is there anybody who really wants to know, okay, अच्छा तो है, चलो बहुत benefits है, चलो सीख लेते हैं, होता कैसे? पता तो पड़े करते कैसे? किसी को इच्छा है सीखने की? Otherwise we'll skip the slides. Okay, there are a few. I'm grateful that there were a few hands. Okay, so let's see what are the meditation techniques. So there are a number of them. So there is from Patanjali Dhyana to Anapanasati, to Spandana Dhyana, Nidra Dhyana, Yoga Nidra, Kriya Yoga, Transcendental Meditation, Kundalini Yoga, Tratak, Surya Namaskaram. So there are many, and various religions throughout the world have come up with certain techniques of meditation. But also the most important thing is you can have your own system of meditation as well. For whatever is comfortable to you, you can use that for meditating and calming your mind. So these are the techniques, and you cannot point and say, okay, this is the best one or this is not, because all of them are great. You need to choose what fits you the best. So trying those things out, there are a lot of YouTube channels which teach you meditation technique. There are a lot of apps available now wherein you can just go and start learn meditation. So तरीके बहुत हैं और आसानी से मिल भी जाएंगे. It's just that whether you want to just take that first step and go and learn it, right? But I won't disappoint you. Since we have come up over here to know how exactly it is to be done, we'll discuss it, one of the techniques, a little in detail. Okay? So before beginning meditation, it is important to take care of a few things like the time and the place. You can do meditation at any time of the day or evening or night and at any place. However, it is suggested that you fix times, fix a timing and practice meditation and also fix one place and practice meditation at that particular place every single day. Changing of time, and it is preferred and it is suggested that you, if possible, you do the meditation during dawn or at dusk. But that's not a compulsion. You can choose any time of the day for meditation. Clothing, light clothing is preferred so that you can sit comfortably and nothing is troubling you while you're meditating. Cleanliness of the spot wherever you sit is very important. Quiet environment is very important. And there needs to be some focal point on which you can focus your mind on. Meditation can be done either with open eyes or closed eyes. It depends upon what is convenient to you. However, problem with closing the eyes is that you might fall to sleep. So just the whole idea of meditating is just this, that so that you can remember the experiences that you have while meditating. While if you sleep, you don't really remember what you really experience in sleep. You just feel fresh, but you don't really recollect what you experienced, right? So that's why but then you need to be alert even if you're closing your eyes, okay? So what is the process of meditation? So here, the process that has been shown is of Raja Yoga, Patanjali Raja Yoga. If you talk about yoga, that Raja Yoga has got 8 components, starting with Yam and Niyama. That are the first 2 components, which means that there are certain aspects that you have to develop in your life just beyond what you actually perform while meditating. So since, as we have already discussed, that yoga is not just a thing or an act to be performed, but it is a way of life. So Yam and Niyama means the dietary habits that you put, the waking and sleeping things, the attitude that you have to leave behind egos, desires, and these are the things, being truthful, being honest. So these are the Yam and Niyamas that have been told to be incorporated in the life. And then we begin the meditation process. So the first step is the asana, which means posture. So meditation proper, it is preceded by a proper posture. So you have to be in the erect posture, preferably better than reclining. As we have already discussed, that reclining position will make you sleep. So you have to be sitting. Either you can sit on the floor in any of the asanas, which is comfortable to you, Padmasana or any of the things, or else you can just simply sit cross-legged. There's no specific thing that you have to sit in a particular way. It's just that you have to be comfortable and steady. You can sit on a chair if it is comfortable and meditate. So asana is just a prerequisite for just being comfortable and steady in your posture. Then the second thing, or the second step, is the pranayama. Pranayama means the breathing exercise. So the simplest form of pranayama is to take inhalation slowly and to breathe out slowly. That is the simplest form of pranayama. So after sitting properly, you try to take 4 to 5 slow and deep breaths so that your mind focuses on your breathing. After pranayama, there comes pratyahara, which means gathering together. Also means sensory withdrawal. So there are steps. Once you focus your mind on your breathing, then you will start noticing pankhe ka awaaz, TV ka awaaz, iska awaaz. So that is the first step and you don't have to be disappointed that why are you feeling these sounds when you are sitting to focus on one particular thing. It's a good sign because since it indicates that you have started focusing in the present moment and your thoughts are not wandering anywhere. So it starts with focusing your mind, and then slowly you try to eliminate all those sensory perceptions that you are getting and try to focus on what is known as one focal point. As we have already seen, that prerequisite is to have a focal point. So you withdraw from all the sensory perception, and then the next step comes, which is dharana, which is known as concentration or focusing on your mind on that one focal point. Now it is recommended that the focal point or the sound that you choose should be meaningful so that it has more effect. And after dharana, after your concentration is reached, you reach a state of dhyana, which is known as meditation proper. So dhyana, to reach the dhyana, which is meditation proper, these are the steps that you have to go through, or rather you go through to reach that stage. So dhyana is considered to be feeling one with the object that you are focusing on. So that is what dhyana means. After dhyana, there is another stage which is known as samadhi, wherein there is union with the higher consciousness, which you reach after practicing for a very long time. Also, there is one recommendation which is given while doing dhyana or meditation. It's not that once you reach dhyana, there won't be any disturbing thoughts coming into your mind. They will be, but instead of getting irritated by those things, there are techniques to get those thoughts out of your mind. First is you can ignore them. Just simply ignore. Don't let them affect you. Don't think, yaar, abhi to baitha tha, ye kya aa gaya, wo kya aa gaya. Nahin. Let them just pass by. Second thing is, you can choose to just cut them. Okay? Cut them. Don't just repel those thoughts and just say, no, this is not the right thing to think right now, and then forget it. And the third thing is to just write it down. If there are certain thoughts of to-do think list are coming when you're sitting and meditating, you just write those things down so that your mind is free of remembering those things. So these are a few techniques to just let you be in that position. It is a great step to begin meditating and taking your life in your control, reducing the stress, taking it as a stress reduction technique. However, meditation, to be truly effective, should facilitate bringing in the whole wisdom of the universal wisdom into your everyday life. So it cannot help much if it is used merely as a relaxation technique, even though it is a great start to begin meditation as a relaxation technique. So you need to make sure that you don't leave the rest of the life completely untouched, but using the way of meditation to bring about a growth in your consciousness to reach a better level and a higher consciousness than what you are right now. These are the references. Thank you for your patient listening.